you've been brought into the emergency room from an ambulance, for example, you might not even remember coming to the hospital or all the things that have happened in the emergency room because you've seen so many strange faces and unfamiliar terms, but it's my job to make things a little easier.
You'll be taken care of by the hospitalists, the very experienced in-house doctors trained in hospital medicine. So you'll be leaving the emergency room after we've completed our work here. I've spoken to the hospitalist, and he'll be assuming your care. He will be in communication with your doctor. He'll have all the information I have, and you'll be in good hands, and eventually you'll be released back to see your doctor.
The hospitalists are really the brains of the operation.
They're the ones that pull it all together, and I mean, this is what they do, this is what they're good at, and they navigate the hospital for patients, and so really it's their advocate for care.
It is a recent occurrence that patients' own physicians don't come to the hospital anymore to take care of them.
Hey Kevin, how are you?
The hospitalists that will be taking care of you will have coordinated care between your own physician. This will allow the hospitalist to be able to order the correct tests and x-rays, obtain the appropriate consultations, and be able to make your hospital stay as easy on you and as efficient and as comprehensive for the reasons why you came to the hospital.
My name is Dr. Ju. I'm one of the hospitalists. I'm an internal medicine doctor that sees patients that are critically ill and that need hospitalization. My role is to be here in the place of your primary care doctor. Your primary care doctor is Dr. Perlman. Mm-hmm. And so Dr. Perlman is focusing on your care outside of the hospital, and my role is to focus on your care inside the hospital. And then, of course, when we make that transition back to the outpatient side, she will resume your care.
Okay.
The biggest thing that I get from people is that you're not my doctor. I've never met you before. How can I put my trust in someone that I've never met? Which is a very legitimate concern. And I would say to that, we love taking care of patients. It's what we do. We're all very experienced with it. And we like the idea that we can have someone come in and we've never met them before, and we can form a bond with them and take care of them. For us, it's a good journey. It's a good experience.
As a patient, you will care that your hospitalist is available to you. It's no fun to be in a hospital bed for any length of time. And so most people desire to go through their hospital stay as quickly, as safely, and as efficiently as they can. Hospitalists have resulted in reduced length of stay as well as more efficient use of resources during the hospital stay.
I do feel like I'm part of the team. It's kind of like a cocoon around me. And the care that comes from that makes me feel safe, makes me know that there's a path ahead, and when I lose my way, I can ask someone, you know, where's the path going to take me? And they have answers for me, and it makes me feel secure.
As a neurosurgeon, I primarily concentrate on the brain and spine disorders. The hospitalists can't certainly do any neurosurgical surgery because they just are not trained to do so. In many ways, I'm not trained to provide medical care for the various different types of medical problems my patients have. So I wouldn't rely on someone like myself to handle diabetes or hypertension, but we have people that are very good at that in the hospitalist program. So it is a team approach, and the patients actually are very grateful that there are other doctors that are very good at these other medical problems. So it should be seen that way by patients, and they should feel very comfortable and glad that many people are around to help them.
The biggest thing patients, I think, can do to help us is really to communicate. I think our biggest role as a hospitalist is really to understand what's going on and to hear it from the patient. That's the biggest thing you can do to help us, is really to communicate with us. We find it's very important to have family members involved. That being said, I think it's important to have a spokesman for the family when you come in. You know, a wife or a significant other or a daughter or son might know a lot more about you if you're ill. And forgive us, we mean no insult to you. It just means a lot for us to hear about it from people that have been close to you as well. You're the most important part of the team, of course, because ultimately what you say and do not only helps us with the diagnosis, but really sets a course for what you want to do. We are, after all, your biggest advocate in the hospital. We all trust and respect our specialists and much appreciate a team of doctors who help come upon a plan for you, but our biggest role is really to serve as your advocate.